Welcome everyone to today's webinar. I am Emma Beamer with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our moderator, John Adractis. An evangelist, John regularly advises and speaks on lean innovation and consumer engagement across healthcare, financial services, and tech. John is currently the Chief Growth Officer at Simply, leading go-to-market, business development, marketing, sales operations, and strategy. Previously, John was an executive across entrepreneurial, Fortune 100, and venture capital environments. John holds a bachelor's degree from the University of Pennsylvania in mathematics and philosophy, and an MBA from the Harvard Business School. An avid musician, John is a professional pianist and tiger dad of 3 kids. John, I'll now turn the floor over to you.
Great, thank you, Emma. Hello and welcome, everyone. I'm John Adractis, and I'm really pleased for today's panel. I think this is such an important topic to many on a personal level as patients, as well as timely in the world of healthcare from a revenue cycle perspective. And we will be focused on thinking about patient financial care. What does it mean? What are people doing about it? What's the impact that comes from it? And in today's panel, we've got 2 really exciting, innovative systems and some of their core leaders who are here to share their insights on that topic. So with that, I will turn first to think about learning objectives. And this is just a good start kind of for any of these educational sessions, that we're going to try to zoom in on thinking about certainly metrics and the ability to how to measure satisfaction beyond kind of some of the classic financial metrics that you might have, thinking about how that ties into patients and their success, as well as some of the design techniques that are employed behind that, and ultimately thinking about some of the best practices that are critical both to bring to the market in that and to continue to improve upon. So I'm going to turn at this point to the first of our 2 panelists, Mike Mullen. And Mike, if you perhaps share a bit about yourself as well as in terms of the system you're from.
Sure. Thanks, John. My name is Mike Mullen. I've got 20 plus years doing revenue cycle work within the Chicagoland area. Worked at 5 different facilities, and I'm currently the director of the West Region Revenue Cycle for Northwestern Medicine. Northwestern Medicine is 7 hospitals and currently in growth mode. I manage all the revenue cycle responsibility for the hospitals in the West Region, which is 5 hospitals and 2 physician groups. I've got an undergraduate degree in finance from Illinois State University and a master's degree in healthcare administration from Lake Forest Graduate School of Management.
Thank you, Mike. That's great. One question came to mind as I was thinking about it. Do you think in life you chose healthcare or finance first, and kind of how those 2 became intersected?
I started in the financial world, in the financial markets, and then just had an opportunity to move into healthcare, and I've been in healthcare ever since.
Well, that's great. It's always interesting hearing people's different stories coming in. Thank you for that. Looking forward to our conversation. Brenda, turning to you, if you would, just to give us a bit on yourself as well as Mayo Clinic.
Sure. Hi, I'm Brenda Schillinger. I'm Vice Chair of Innovation and Systems at Mayo Clinic. Fortunately, I've had some wonderful opportunities to work for large organizations across the United States, some of those in healthcare, some of those in technology. I started my path very clearly in the clinical arena from Marquette, became a family therapist through some work at UW-Madison, and then joined the finance team, if you wish, as Mike did, through an MBA. And one of the things that I really find enjoyable back in the day of nursing, it was the critical path and how to improve patient outcomes. I've continued that work through Six Sigma, Lean improvements within the organizations that I've been in, and I'm wildly excited about the work that we're doing to imply lean techniques into the patient experience, because what we're experiencing today is that patients want that very lean environment and improves their engagement. Mayo is, as it shows on the screen, quite a large organization stretching across all the 50 states and many countries. Happy to be ranked #1 in the nation, and employ quite a large number of physicians doing many specialty areas. It is world-class clinicals, and what we've come to want in our revenue cycle is a world-class revenue cycle to match that patient experience. So looking forward to talking a little bit about a segment of the work that we're doing to make it a world-class revenue cycle today.
Fantastic. And with that, the perfect segue as well as we get to the first major topic for today, and that's really understanding what are the motivations to talk about financial care. What does it even really mean? And a little bit of inspirational quote here about the difference between sort of revolutionary enhancements versus how do you actually think about where the world is changing toward. And with that in mind, let me set the stage a bit here from the point of view of patient financial care. If you're thinking from a patient hat, the world can be really confusing and frustrating, and you can feel potentially challenged to even be able to be a customer of healthcare. I say that as a father of 3, and of course awareness of friends and family members, where you look, some of the stats are really astounding. This is just a collection of a few in terms of people being confused by the information they received. In some ways, what might almost seem like set up for failure for the patient, and I think also perhaps even that parallel to the provider, where if most people have a limited amount of savings, and then you look and you think, well, the healthcare costs are in fact much higher than an average kind of consumer monthly expense, that it's not surprising to see that patients are choosing less care, potentially no care, avoidance. There are some really surprising stats on millennials and their attitudes, and at all kind of, I think, spectrums, you see this. And from the provider perspective, that this rises now above some of the noise, where high deductible plans represent a significant challenge. It may still not be part of that commercial equation, but it becomes a threat to perhaps the mission, beyond the threat to the mission, the threat to certainly being able to deliver on the business, the clinical business. And the growth rate doesn't suggest that this is stopping anytime soon. So let me turn from that really to our 2 panelists today, and from that probe a little deeper into what exactly is sort of the drivers from your perspectives as leaders individually, as well as from your respective systems. Well, why are we talking about this today? Brenda, perhaps you want to kick us off since you started.
Yeah, sorry. So the main value of Mayo is that the needs of the patient come first. And when we took a look at the patient's needs and the patient experience, we recognized that our revenue cycle had some opportunities. So certainly patient experience, patient expectations, and mission alignment were our key drivers in the want to take the back-end processes within our revenue cycle and revolutionize them, again, to make them world-class, to align with our world-class clinicals.
And I remember in one of our conversations in the past, you had made that comment about the desire to wow a patient and feeling that kind of connecting this with sort of threatening in that. Is that a way that you sort of, is that a good restatement and or thinking about that?
Absolutely, and I think that what our patients expect is not just standard customer service, but it is that wow factor. Again, to match our world-class clinicals, patients don't come to Mayo just to be satisfied. They come to Mayo to be wowed from a clinical perspective, and so there is that need to go beyond the voiced expectation, if you wish, and be the driver of the next opportunity, if you wish. Kind of what we saw in the quote in the slide before.
And I remember specifically when I was out last year and spoke at the Center for Innovation, and that audience was predominantly clinical even. And some of the themes that came up beyond even the patient experiences was patients dropping out. And I remember being fascinated and of course concerned as a citizen that a problem that doesn't just affect, of course, Mayo, but kind of a theme throughout is a patient coming for their care and realizing, wow, the responsibility financially is almost overwhelming, and that's changing how people proceed. And whether it's cancer patients potentially afraid of their procedures and finding yet another reason to maybe delay something that they really shouldn't, and that this was a concerning thing. So I love this framing, kind of kick it off. Mike, is there anything you want to add from that perspective? Is it similar for you?
Sure.
Any additional
Yeah,
points?
very similar at Northwestern. So our mission at Northwestern Medicine is patients first. And so we tried to adapt that in the revenue cycle as Brenda did, and really try to enhance the patient experience. And, as mentioned in the earlier slide, the patients are very confused most of the time when they get a statement. So we tried to really change that in the appearance of our statements, and then also making it just more patient friendly, less confusing, and easier to read. And at the same time, knowing that we're continuing in the healthcare environment to see patient balances grow, we wanted to offer our patients every means possible to make a payment as easy as possible. So we really enhanced our online portal and just the mobile experience that patients have available to them. So, we really took that patients first mission into the revenue cycle when adapting some of the new technology within our statements and our online portal.
That's great. I think this is in fact a perfect segue as well to go from thinking about why we talk about this to thinking about what the vision is, right? What is there a plan in your minds when you think about what you're investing in, and is there sort of kind of key phases to it, or just given that you're also very large systems where you might start in one part of the system and you have to kind of keep up with your own acquisitions and things and be really continuing to connect the dots? How would you define kind of that plan today?
At Northwestern, like you mentioned, we are a growing system, and we are a system that has hospitals on different platforms of Epic, and we're working to bring that all together. And so, we've been thinking of that when we first started to create our statements, and then also with our online portal to bring this all together down the road, where we will be at the end of next year. So, we definitely had that vision in place when we started this journey on creating and enhancing our patient experience around the revenue cycle. So, you also have to be, everybody's on their phones and the mobile technology and offering the different venues of pay, whether it be through PayPal or, just the mobile technology. We had that in our mind when we set this up, because we didn't want to have to redo this 2 years after we went live with our new statements in our portal. So we definitely had a vision in mind when we started this, and it's around growing as a system, bringing on new hospitals and new physician groups, and making it as simple as possible for patients when they receive care at Northwestern and then have a subsequent bill.
That's so helpful getting that framing. Brenda, you sharing many of the same? Are there elements that are are different, and of course, one coming to mind, you're making major changes from the the HIS, and then had a big implementation kind of happening in parallel. Things you'd like to add, vision and/or where you're at?
Yes. So this is no surprise to many that Mayo is currently implementing Epic as our core EMR or CM, and part of that reasoning was to bring the continuum of care from start to finish onto the same platform, so that we had a kind of a solid launch pad for patient experience across the clinical and financial world. Interestingly enough, there was a video that we shared with all of the RevCycle staff entitled "If Air Travel Worked Like Healthcare," and that vision of just poor performance within healthcare where things aren't aligned. If we did that in airline travel, no one would fly. And so it was a very powerful kind of visioning where we're trying to align everything, making sure that when a patient enters the doors of Mayo, they're not just entering from a clinical perspective, but how does the wraparound support of the financial groups support basically smooth travel through our system, from first touch, which could be mobile, could be web, could be a phone call, to the last touch when they hopefully refer a friend.
I think you introduced such an important kind of theme for today's conversation. That's that idea of the smooth travel. I like that analogy, and I think whether you wear the hat of a digital e-commerce person, and you think in terms of funnels and conversions through, you think of it as the journey of the customer. These are all framings that get to the same, which is, although you might have capability, how does that journey actually kind of work out for you, and how challenging is it if you are in fact that customer? So that's I think we can come back to that as we dive in. One question just to push on both of you, because you brought it up. So how do you think of the world, meaning this is a problem, patient financial care, we're focusing on it today. You both have the context of major HIS investments as well as kind of the acquisition. So was it not already covered in those kind of HIS plans? Is this something you viewed as something that was kind of an additional and a very important separate piece? Because you obviously made some choices there. You didn't just do all of this within that program, and you complemented it. I'm curious to know more about why you might have done that.
The reason why we did it, we are an Epic shop, and the reason why we did this is, for those that are on Epic, Epic's statement is very basic, and it might have improved in the new version, but yet in the version that we were on, it was a very basic statement. So, we wanted to really enhance our statements, and that's why we looked outside of the Epic platform to do this. And the same thing with our online portal. Current Epic functionality through MyChart, you're required as a user to have a password, a unique ID and a password. So we wanted to give our patients another avenue to get in as quickly as possible, and not to have to remember their account ID or login and then also their password. So we wanted to make it as easy as possible for a patient to get in, get out, make their payment as quick as possible, similar to an Amazon experience. And so that was the reasoning behind looking outside of our Epic system to do this.
And I echo Mike's sentiment, that Amazon-ish experience where it's clean, it's simple, there's a clear path to action that the customer, if you wish, understands, was one of the reasons. We understand that healthcare finance is confusing at best, regulations are confusing at best, payers and the EOB experience is confusing. How do we help the patient understand? How do we help them understand what action needs to be taken? Was part of our engagement with Simply.
So with with that sort of setting and context, we have some highlights here of areas that we sort of called out, starting with Northwestern and for Mike, of some of the elements of what you guys have been doing so far. It'd be great if you could share some of the insights through them. Mike, you want to kick it off?
Sure. So as you can see up on the screen, to the left is our before statement. So that was your basic, very confusing, not so pretty statement that we were producing 2 years back. Partnering with our vendor, we really took time to address the patient needs. If I was a patient, what would I like to see? What would make it easy for me to understand what the bill is for? And so we tried to do that and make it as simple as possible. You could see how much we spell out, like it says, our digital strategy. We really gave the patient multiple areas to focus on and how to pay their bill digitally. So you could see we also have our MyChart link on that statement, and then along with that is the online portal where, as a patient, you can just go on real fast as a guest, make your quick payment, also set up an online payment plan, store your credit card. So, we really focused on that digital strategy when we developed this new statement. You can also see that we put a QR reader on that statement. So if utilizing your mobile phone, you can just use that, scan it, and it takes you right to that link to pay your bill. So we really focused on, knowing that just as everybody's paying their bills and doing everything on their phone, we really wanted to take advantage of that. And, as you can see in this statement, we've really done a great job in that. And, the results have spoken for itself.
That's great, Mike. I think as we turn in some ways beyond the bill, or the statement, it's sort of a point of what's really involved in this anyway. Is it about the statements? What's the level of kind of trust building and kind of transparency piece, that's an element of this story too, I think. Any thoughts on that here?
Like you said, right, in this screenshot, our patients, the feedback that we've received from our patients when we rolled this out is how easy, just how simple it was laid out for them. And, they didn't have to go on, try to figure out what they were looking at. Just the feedback that we've gotten from our customers has been great. And I think you've put some of the feedback that we received from our customers on here. So it's a very simple layout when you get online, sort of that Amazon experience. It's quick and easy, make my payment and I'm done. And, it rolls it all up into one screenshot. You can expand to get more detail. But the best part, I think, one of the things that we're really excited about and what we've done is to allow a patient to make that payment plan and store their credit card, so it's automating withdrawal every month. And as a patient, I just have to do that one time, and then I get an email alert that lets you know that they're taking a payment out, and you have your receipt, and you're done. So I think that's been one of the best things that we've done with this, is just the ease, and just really went into our mission of patients first.
Fantastic. You touched upon a couple of themes here, and I think there's a few of those kind of highlighted here from just different points of interaction. Have these played a key role in your mind? How do they relate?
Definitely. One of the things we just recently rolled out was an IVR system through our customer service line. So we did not have this in place a few months ago, and we just rolled this out. And just having that benefit of having this automated IVR allows 24/7 payment options available to a patient. So, we've seen some good adoption of this, and I just think that's been a great newer enhancement that we've done. So, we, like you said, we are always looking to advance and make sure that, we're top decile, and that, we're just making and giving those patients every option available to make that payment whenever possible.
That's great. I think maybe at this point, let's switch a bit and Brenda, comment on some of the things so far and/or things you might add to this equation.
Yep, absolutely, Mike. I think you've done some phenomenal work, and Mayo has taken much of the work. When we implemented the solution, we looked at best practice in the industry and took advantage of many of the options that Mike notes. One of the things a little bit different at Mayo is that we have a guarantor view that encompasses more than just a single patient, and so we've allowed for a drill down into the different areas of a guarantor's financial responsibility. Again, looking at that Amazon type experience, how do we make it easy if you want more, to be able to drill in and see more, but how do we make that payment something that's quick and easy, and the engagement there. Every option that we, go ahead.
Oh, sorry, no, didn't mean to stop you. I was going to
engagement we have. Go ahead.
As you were talking about the engagement piece, I noticed that as you mentioned on the guarantor side, you also made a particular choice around the patients themselves, even when they're not the guarantor. Is that something worth noting?
When they're not the guarantor, meaning that they have access to view their information if they would like to, yes. Again, empowering, I think the most important thing in healthcare that we've seen kind of change from our clinical perspective is they came to Mayo for experts and weren't really engaged, hadn't done a lot of research, but now with the idea of being able to Google conditions and information on different medical care, our patients are very informed oftentimes, and so they are very much engaged in their healthcare. We wanted to have the same level of engagement if they wanted to on the financial side. How do we make sure that we're transparent, as John and Mike have noted, from all aspects? I think payment plans were one of the things that Mike mentioned, and certainly something, again, to empower the patient to take action on their own behalf. It was very powerful to put this in the hands of the patients and allow them to set up reoccurring payments. We've seen a tremendous increase in the amount of payment plans by allowing them to set these up online by themselves. And I want to reiterate the message kind of on a slide earlier. We've gone from being offline to online, and we're seeing engagement 24/7 now, rather than just the typical 8 to 5 when the business office was open, which is, again, looking to our patients. Our patients are busy, oftentimes professional, and they have the time to be investigating this kind of information on their off hours. So we wanted to make sure that we weren't off during that off hours and that we were online in some way.
And you shared with me when we were kind of talking about this, when it comes to age and demographics, it's often a common question that I have seen in my research about, wow, does this apply only to millennial generation, or who does it refer to? And I think you had a specific patient that once made a comment and was quite astounding.
Yeah. I'm not sure if I can remember the exact comment, but I can tell you that we've done demographics, and we were blown away by the demographics. We have patients in their 80s, 90s engaging on online, and we've had even folks over 100. So everyone is getting more engaged in the online experience and in their financial experience as well.
No, It's fantastic to hear it. In some ways, just, as I said, as a father of three, I've seen my own parents go from their technology use being, I'll call it minimal, to even higher, if for any reason, because of the grandparent effect. I think it's a common thread that I have seen on an anecdotal personal level, but likewise, I think in the research, we find this to be generally true, that there is broad adoption across different segments, age-wise, and this is kind of healthcare is catching up to the things that is happening outside of healthcare. So it's like as we come to healthcare, we bring those same kind of expectations and experiences with us. And it's really great to see the two of you leading the way and how to kind of level the field for the healthcare perspective.
Mm-hmm.
So with that, why don't we transition? We've talked from why into the what's and into the how it's been impacting. And with that in mind, I think kind of first and foremost comes a bit of, well, how are you even thinking of what success is? How do you measure it? There's tons of metrics in the world of finance and HFMA guidance of map keys and things. But if you look through them, sometimes it's challenging to find a very consumer success metric in there. Do you guys think differently on this? Do you have important metrics in mind to gauge the success of your efforts? I don't know if Mike, you in particular, as you think about some of these, whether that be on the role of satisfaction versus the financial return, is that something
Sure.
that now plays a role in revenue cycle, perhaps?
Yeah, definitely patient satisfaction was a big area that we focused on when we went live to definitely measure the comments and take into account what our patients were saying after we rolled this out. And so, the way we looked at it is, if our patients are satisfied with our, the tools that are available to them to make payments, it's going to make it much easier for them to make a payment rather than just signing online, getting into it and getting confused, and then just signing out and just saying, you know what, I'll pay this later. We wanted to make sure that, customer satisfaction was key, and, and we wanted to make it as simple as possible. So, our motto was, the patients are happy with their experience, they're going to go ahead and make that payment. They're not going to get frustrated and close out their web session and then contact our customer service where they might have to wait a couple minutes to talk to a rep. So, we really kept an eye on patient satisfaction when we rolled this out.
If I hear you right, there's even two themes in what you were saying. One, the clear focus on satisfaction being measured in new context, certainly into the revenue cycle. Beyond that, I heard the notion of that ability to kind of complete on their own, which some could call the self-service metric, the online metric, but that sounds like that is equally as important, and I think you'd almost describe it as they succeeded on some level because they actually completed it. Is that how you think of it?
Oh, definitely. Self-service is so important, right? Patients, just consumers in a whole, in today's environment, they want it as simple as possible. They don't want to have to, wait on a phone call to make a payment. So, the self-service piece is a big area that we focus on, making sure that we're seeing an increase in the payments that we're receiving, from what we call self-service, where there's no interaction needed between a patient and a customer service rep.
And as you were saying that, I was thinking, I know we had a few highlights here. I think they start with yours. The notion of the self-service being in different pathways, and whether or not you sort of only one mattered. You've mentioned the fact you've introduced another. Why have all these pathways? What's the value in it?
Well, as you mentioned, self-service is key. And so we wanted to give our patients as many options as available to them. So that's why we had we have two portals, one through MyChart, Epic's MyChart, that you can sign on and make your payment and review your records. And then we have our simple online portal where you don't need a login. and you just get in and make that payment as quick as possible. And, so that's the reason why we have the two different options available, one through MyChart and then one through our online portal, just to, to increase that self-service.
No, and as you think about that self-service, we talked about these as kind of important metrics. How does that kind of translate? Do you see that as a self-service being connected to the satisfaction piece and/or into other impacts, and sort of brought up the projection right now in terms of your growth on the digital side?
Yeah, definitely. I mean, you could see, the chart on the right speaks for itself. And I think based on that, I think in turn we've seen that growth in the digital self-service payment. I think as I just mentioned, as if the patient feels that they understand why they're making that payment based off of what is available to them on the portal, they're going to make that payment. So the results are speaking for themselves right now as far as how satisfied we are seeing our patients are that are utilizing our online portal, and then the payments are just rolling in as a result of that. And you can see over a year period of time, just the tremendous growth that we've seen in the self-service payments through our online portal.
No, and then somewhat coming back and connecting some of the dots, you spoke earlier about, the adding of, the IVR, which is at the end of the day sort of not internet-based, but between that, the mobile and other pieces. Does that sort of fit into this trend as well? It's all part of one set of let's call it focus on making it easy.
Yeah, definitely. As I mentioned earlier on the call, the IVR, we've seen some great results there, and it's just enhanced the self-service payments that we've been seeing over the last few months. So, we're just rolled on 2 new hospitals at the beginning of the month, and so we can't wait to see. This is all new to the consumers out at these 2 hospitals. So we're hoping that these numbers just continue to grow.
No, that's great. I mean, I think even just reflected here is that it's well more than 6,000 responses. And I think some people have often asked me about, well, you have your Press Gainies and the HCAP surveys that go on. This is something that is above and beyond, clearly a sort of a new area for you to know about what people are thinking as they go through their revenue cycle journey, and not just the clinical journey. Very exciting indeed. I put a sampling here of some of the comments that people have made over time. I think I always find it most amazing when you kind of see it in people's own words. I think some of the ones that sort of stuck out is you see the people making comparisons. And this is something that I would say, like in my research across patients in the country, which is now about 250,000 and growing, but this is quite common. The idea that people are noticing. It's a huge kudos to you and to Brenda for investing in this area. Beyond the noticing is I can't help but put on my strategic hat and say that I can imagine things will be shifting from a strategy, and certainly even thinking about brand. When you have people starting to say, well, wait a minute, I remember my experience at X and this was better. Is that play a role in your thinking about this in terms of how the brand and kind of the perception relative to the market?
Mike, I'm not sure if you have an answer for that, but certainly from a Mayo perspective, it is a deciding factor for us. Again, that world-class clinicals linked with a world-class financials is important. We have customers that walk away when the financials get to be a nightmare, right? That happens in any organization, any industry. And so why would we want to jeopardize even one patient? We would rather turn them into, as the slide shows, a recommendation. That's the power of healthcare today, and it's a deciding strategy that we've taken a look at. How do we make sure that our customers are telling other customers of their great experience and turning those customers word of mouth, if you wish, best marketing that we can have about the positive engagement from both sides of the continuous picture at Mayo.
And I included a slide here because in both your cases, we haven't called it out specifically yet, is a metric that I think is fairly new to healthcare. I don't know if what you would think on that, but the Net Promoter Score. It's certainly not new and outside of the healthcare context, but you are both now measuring that through these experiences of every patient who has taken the survey is giving you feedback directly on their experience, as well as being asked a very tough question on recommending. And here's some of the methodology it's included. I don't think we need to go through it in this minute. It's a very high standard. You might be familiar with it. It's easy to benchmark. Certainly, it's considered to be the one metric because you can look at one thing and see the impact on that. And then sort of putting that a little bit in the context, here just using Mayo as the example. How does this hit you, Brenda, when you look at this? Is this new information for you as a system? Is this really important? Is it you who thinks about this? Is it beyond? What level of leadership interest is in this kind of information?
Yeah. Great question. And the Net Promoter Score isn't something that's new to us. The ability to actually measure it is what we're wildly excited about. We've always heard, my neighbor referred me, my best friend referred me, my aunt was here and had a great experience. Now we have a way to actually quantify with a kind of proven metric who might be, what percentage of our patients would actually refer back somebody else. And so to see that, average healthcare is at 18, it's great to see that Mayo is a little bit above that, but we want to be where Mike even mentioned, we want to be at that Amazon. We want to be at the Southwest before Amazon because we want to run healthcare like the airlines would run healthcare, not like we currently have healthcare structured. So and these kinds of statistics, these kinds of engagements aren't just looked at, as you mentioned, John, by our financial leaders. Our providers are engaged at this level. They want to understand how patients are reacting to their care across the continuum, how others in our community are being encouraged, empowered to take action and choose Mayo. Healthcare has become incredibly competitive. How do we make sure that we stay? We're currently celebrating a few years more than 150. How do we make sure that we are in it for 150 more?
No, that's it's so exciting, I think, to hear both you and Mike having this theme around the satisfaction measurement and the attention to care to this. And even if something had been, in the blind spot before, but the conscious kind of push toward it, I think you can only get excited as a patient as well as someone working within healthcare. And in particular, I will say what I have seen in the other systems as well is not only measuring it in the RevCycle context, but finding that the marketing team is much more engaged. I don't know if that's been a direct experience at either of your systems. They want to think about what they can do with this from the acquisition perspective. This going from thinking about the billing and payment experience to measuring other experiences. And we have seen some providers, they won't always share it publicly at first, but they want to start measuring. Then they realize, wow, we've got things that are negative, right? Competing with Comcast of the world, and that's not to beat up on Comcast, but where there are opportunities to substantially improve, and then using it, not to say a negative 17 is what you care about, but the fact that it's moving in the right direction. And I love that you guys set your goals at the highest of levels, and I think that's super exciting. From here, really turning so we can have some time, there's been a lot of questions coming in, and if I think we can start to take a peek at the first here. One of the questions that came up was, how do you get C-level leadership buy into an approach that seems different? Have they played a key role in the decisions on either of your respective orgs? And if so, who and how did that happen?
At Northwestern, we had buy-in from our senior vice president of finance, and so with him being our executive sponsor, that really helped with this project. And then having IT engaged, and as well as marketing, like you mentioned earlier, how marketing has been playing such a key role today, that we had some great buy-in and some great partners throughout the system to really have this, or to make this a successful project.
That's great. Brenda? Yeah, perfect.
Yeah, so from our perspective, the interesting thing was Dr. Noseworthy, Jeff Bolton, our CEO, CAO, top leaders of Mayo. The only thing we needed to talk about was our Press-Ganey scores and the fact that our patients' needs were not being satisfied. And once we showed an opportunity there, it almost flipped on us, and we became they became the leaders, the poster children, if you wish, for change. And in some ways, we can't keep up now with the demand for patient engagement in the financial area and the resource and support that is coming from our C-suite. It's very exciting.
So with all this positive kind of motivation and momentum that's happening, I can't help but sort of switch in my mind to, so was this hard to do from the point of view of getting this done? Sometimes thinking about an implementation of an HIS is really measured in years, if not parts of a lifetime. What has this been like in being able to do this? Is this an area that one should put behind and say, I'll get to that once I finish the massive implementations in the background, or is this one that you can accomplish on a different scale?
Yeah, so John, I'll jump in here. As I'm leading the Epic implementation for Mayo, and then thinking about, oh goodness, how do I lead another implementation? This solution actually was put into our legacy systems, and when resources are so stretched, I was thinking, how are we possibly going to do this? One of the kind of key distinguishers then in our RFP process was, what level of resource demand would we have for this project? What's the timeline? What's our guarantees to accomplish in the timelines? Because we were tight, right? We had limited resources from even our IT staff as they were moving on to the Epic project. And I am very happy to say that the partnership was amazing. It was actually Mayo's delay that in some ways when we didn't hit timelines, always it was Mayo's delay when we didn't hit timelines. The partnership was phenomenal, and I've worked with many vendors. I've not experienced the level of customer service like I have, and I know that sounds like a sales pitch. I'm not a salesperson, but I also want to give credit where credit is due, and it was really that partnership that allowed us to be so successful in the period that we're in, with all the kind of tug on resources internally.
Thank you, Brenda, for both the words, and I think as you describe it, that word partnership really resonates. It's exciting and easy in some ways to partner with people that you feel are changing the world really in a way that I will say I would want for my own friends and family, and I think from just a point of view of where healthcare should go. I think both with yourself and with Mike in the Northwestern system. One thing we've talked about a bit earlier here was the notion of payment plans, and that being an important thing as it seemed. I'm sort of want to poke on that. So let's just put on sort of a pure hat and say, well, wait a minute, people paying you over time, that sounds somewhat problematic. I want to collect the money now. Why would we manage things that way? Why are you excited about payment plans? Why is that important?
As a consumer, like you said, you're a father of three, I'm a father of two, and the last thing you want to have to do is to take your child to the emergency room. But when you have to, you might get stuck with a large bill that, just comes out of nowhere, and you just might not have the available funds to make that large payment. So, having a payment plan option, interest-free, is just a great way to really get that payment over time and, reduce that amount going to a bad debt write-off to a collection agency for further follow-up. So offering a payment plan and making it as simple as storing your credit card information and automating the message that says you're going to be deducted, in 2 days. I just think, over time, we have seen at Northwestern the number of patients that are going on payment plans just continues to climb and climb. And so, patients are just stuck with larger balances now. And, we want to be able to help those patients and, not refer them to a collection agency and have that, reputation in the industry that Northwestern is, out to collect every dollar any means possible. We don't have that reputation. We work with our patients and we try to give them as many options as available to them to make a payment. So payment plans are going to be with us forever just because of the high balances due. And so, we just wanted to make it as easy as possible.
No, I
would echo that. Sorry, but from a again clinical perspective, we have worked to drive towards personalized medicine, right? Our patients are John and Mike and Brenda, not a kidney disorder. Same thing on the financial side. How do we personalize the impact of the financials? And to Mike's point, that family, if we understand their payment history, might not be able to afford the $1,000 bill that just came to them in one lump sum, but they may be able to put $100 on a payment plan and pay over 10 months. And through looking forward, the vision would be, how do we make sure that we know about our patients in that personalized way, so we can react to them in a personalized financial engagement as well.
And I'm smiling as a listener in particular, because this is one of the areas as we now think about where the future of revenue cycle goes. I love that personalized medicine paired with personalized revenue cycle down to the level of the individual. And of course, one of the big things that we have been working on in the past year is bringing out, how do you, for each individual, think about that engagement, personalizing it, so that in fact it is thinking about your capacity to pay, not just the propensity to pay, which I think gets a lot of airtime, but propensity being your normal behavior and do you tend to pay things, combined with the capacity, weighting it to, in this moment for this amount, will you be able to pay, that ability to, and thinking about how that will influence how you engage people and ultimately the offers from the payment plan, potentially steering people in certain directions. It's definitely a key thing on our minds as we think about where the future of this goes. It sounds like that aligns well, Brenda, with the vision you were articulating.
It sure does. And actually, I'm sorry, I'm going to jump in. There's a question here that says, that asks about what's the biggest challenge in making the patient first. And what we've recognized, it is truly our own limitations of what we expect from a revenue cycle from a financial perspective. Our revenue cycle staff have been in the industry for 10, 20, 30, 40 years, and they're used to having healthcare the way it is. One of the things that we've had to do, like I mentioned, taking the video of if airlines ran healthcare, what would that look like? Doing the paradigm shift. Same thing to our C-suite. What happens if Amazon was the way that we paid our medical bills? How do we help others start to see beyond the framework of healthcare? Because healthcare is about 20 years behind most other industries that are cutting edge. And so how do we help innovate our thought process? And it's been a tremendous amount of fun once we got beyond and kind of broke the glass in our own thinking of it's always going to be the way that it's always been, to say, how do we take what we're learning and experiencing and really enjoying from other industries and bring that back to our own work? And I kind of like being an individual, so right? Why not individualize our response?
Right. I don't. Very few people I've ever met and said, "Do you want to be thought of as a generic person?" Hard to find, other than sarcastic answers to that. That we're all just so different, and our needs at different times vary. And seeing that come out is exciting. So with that, we're at time. There's a lot of questions that have been popping up. I think first and foremost, just want to establish we will absolutely follow up with each of these. We'll do that sort of offline today. I think it's really great to see the level of engagement that we've had. This has really been an exciting conversation. And if you didn't get your questions in, please take a minute to do that now. Beyond that, slides will also be available. And so if you, through that, we can see who's interested. And I would say, first and foremost, if you send me an email, I'll make sure to get them to you. And beyond that, here's the contacts of both Mike and Brenda today, who I really want to thank for taking the time out to share their work, their vision. And with that, Mike, did you have a last word for the day at the top of mind? Closing out.
Yeah, it's been a great journey, and we still continue to grow. I saw one of the questions about pre-service. I mean, one of the things we're looking to do is to try and enhance our online portal to do this pre-service and to provide price quotes and things like that. So, we're not done with our journey yet. We're just continuing it, and hopefully we'll be able to enhance this and offer more pre-service opportunities through our portal.
And I think it's both, of course, something that makes sense as the consumer, and I think from our vantage, we've been actively working on that as well, and I think super excited to hear that as you'll think about that in your journey. I think it's really how can the patient, from whether they aren't a patient yet to they're actually there as a patient to ultimately they've now left. How can we make that whole journey a smooth one? To go back to Brenda's metaphor in the beginning. Thank you. And Brenda, any last word on your side?
I think that when we put from the KPIs that were identified, when we started to align the needs of the patient coming first in our financials and wanting to build on that patient satisfaction, we had no idea of the impact of our financials on this, and good work is resulting in good financial recovery. So doing the right thing for your patients certainly can be seen as doing the right thing for your business as well.
Fantastic. I think it's the optimal form of alignment, when I think whether it's counterintuitive or surprising that by focusing on the patient's success, even in the context of the revenue cycle, that it not only creates satisfaction, but can have a financial impact and even a broader strategic and brand impact. I think that's kind of a magic alignment when that occurs. And I think healthcare as a whole will benefit the more that kind of alignment spreads. Wonderful. With that, thank you. This has been a really fun conversation. And if there's anything further, I would just indicate we've included kind of the references at the end here and some of the readings that you might want to also look at. But we will adjourn. Thank you so much.
Good luck to all of you.